Hello, I'm Dr. Susruth Shetty. I'm a consultant in surgical gastroenterology and robotic surgery. Today we shall talk about hernias. Hernia is one of the commonest conditions requiring a surgical management. It is important that everyone knows what hernia means and what are the treatment options. Hernia basically means a bulge which is noticed mostly in the groin regions or in the navel region or anywhere in the abdomen, especially in a previously operated site. Hernia occurs because of a weakness in the abdominal wall where there is a defect and the contents within the abdomen protrude out. It could be the intestine or the fat which protrudes out. What causes hernia? It is mainly because of certain conditions which increase the intra-abdominal pressure. It could be because somebody lifts very heavy weights, somebody has chronic constipation or chronic cough, or in some cases it could be a congenital defect in the abdominal wall. The symptoms of hernia are mainly in the form of bulge, which may be associated with pain. And in case of complications, there will be severe pain associated with constipation, vomiting, abdominal distension, etc. The diagnosis of hernia is mainly made by clinical examination, and the physician may sometimes ask for an ultrasound abdomen if there is a doubt. Treatment of hernia is in the form of surgical repair, which can be done either by a laparoscopic surgery or recently by a more advanced robotic surgery. Using keyholes, we close the hernia defect and also place in a mesh so that there is a durable repair. What are the preventive measures one can take to prevent the occurrence of hernia? If somebody is having a congenital defect, there is nothing much one can do, but avoiding actions or avoiding activities which increases the abdominal pressure can be done to prevent the occurrence of hernias. Anyone with a known diagnosis of hernia or anyone with symptoms of hernia should be aware of the complications which can occur. If there is any pain in the bulge which is quite abnormal, or the bulge does not reduce spontaneously, then it is important that they seek help at the earliest, because it could be an underlying complication which can be life-threatening if not taken care of. Hernias are common conditions. Most of the people get some form of hernia as they age. It can be repaired by surgery using minimal access techniques. But when neglected and when complication occurs, the treatment becomes complicated. If you have any of the symptoms of hernia which I have mentioned, kindly visit the clinic.